Hello and welcome to abxtracker.com, your solution to antibiotic stewardship for long-term care communities. In this video, we will go through some of the S-bars within the New Infection tab on the menu bar. When you have a patient that you see that is displaying signs and symptoms of an infection, this is the tab you go to in order to fill out an S-bar form to inform your provider. Note, it is very important that your pop-up blocker be deactivated for this portion. Again, please deactivate pop-up blockers on your web browser prior to filling out an S-bar form. This typically only needs to be done once, but reach out to your IT department in the event you need any help. Once you log on, you'll see the welcome screen with the menu on it. Let's click on New Infection tab. You'll see a variety of potential infection types in the buttons below. These include UTI, no catheter, UTI, indwelling catheter, lower respiratory infection, upper respiratory infection, skin or wound infection, C. diff infection, and other infection of nonspecific origin. Reminder, there is no S-bar for potential eye, topical, or ear infections. Phase 3 of the update will likely contain this new S-bar. For now, use whatever method you are currently using to inform the provider of this type of infection, and continue to track the antibiotic using the new antibiotic tab under the Enter Topical Eye or Ear Antibiotic. Let's pick one of the new infection types and go through it from start to finish. If you viewed the video on the homepage of abxtracker.com, we completed this for the UTI S-bar. Let's pick a different one for this video. Please note that all buttons under this tab have a very similar method to completing. They all will show up on the pending order list below on the welcome screen. They all will need to have results or provider responses input into the system, and they all will require to enter an outcome via the Outcomes tab here and under Enter Patient Outcomes. The process is the same for all the infections underneath the New Infection tab. Let's begin by picking a skin or wound infection to view. Let's say your staff sees a potential skin or wound infection. They would log on to the website and pick New Infection and then Skin or Wound Infection here. This will bring up a form that they are required to fill out, which includes the patient's first name, the patient's last name, medical record number of the patient. Please note that this is very important to get the medical record number correct, as it syncs all other antibiotic use to this number. Please double check to make sure this is correct. Also, if your facility's medical record number contains letters or special characters, please only enter the numbers in this medical record number here. Again, only numbers. Next is the date of birth of the patient, the nurse that is entering this information, the provider that you're sending this information to. Next is the room number of the patient. Again, this is essential that you make sure that the room number is correct, as this syncs to the facility map. If the room number has more than one bed, please indicate that in the bed number, A, B, 1, or 2, or private room. The system has the ability to create creatinine clearance for your patient. This is essential when we talk about the geriatric population, as more than likely there is some degree of age-related kidney dysfunction, and medications need to be dosed appropriately to reduce adverse effects. So, is the patient on dialysis? Yes or no? For our purposes, we will select no. The question then becomes, do you have the information necessary to calculate a creatinine clearance for the patient? Do you have serum creatinine, weight, and height for this patient handy? If so, click yes. If not, click no. For our purposes, we will click yes. Now fill out the appropriate information to calculate creatinine clearance. Is this patient male or female? Enter their weight in pounds. You do not need the label. Enter their height in inches. Again, you do not need the label. Enter their most recent serum creatinine. Again, no label is required. Now we have certain vital parameters that should be entered. Please enter the patient's blood pressure. No label required. Heartbeat. No label required. Respiratory rate. No label is required. Temperature in Fahrenheit. Again, no label is required. Now we have some pertinent questions that come into consideration when an antibiotic is going to be prescribed. Does the patient have diabetes? Yes or no? Skin infections or history of skin infections? Yes or no? If yes, it's going to make you list them out. Does this patient have any medication allergies? Yes or no? If yes, it will make you list them out. Is this patient on warfarin therapy, Coumadin or Jantavin? Has the patient had any antibiotic use in the last 14 days? This will tease out any potential recurrent infections or might change the provider's medication that they order if a particular antibiotic was ordered recently. It may hint a resistant infection. If they have had antibiotic use in the last 14 days, click yes, and it will make you list the medication that they have had. Now it's time to click on the patient signs and symptoms that they have. Also, enter other information that you want to tell the provider. Next, let's click Submit for Tracking and generate SBAR form. Once you do this, two things will happen for all the SBARs under the New Infection tab. The first thing that will happen is it will create an electronic health record note for you. That includes the date, the time that you created the report, as well as a unique patient identifier we call SBAR identifier that contains the patient's first and last initial, as well as a randomly generated number. This is specific to this SBAR form and can be used to search in the pending SBAR forms and the welcome screen. Other information is pertinent information that the patient is displaying here, as well as other notes that you put in. Also, vitals are included in this note. The nice thing about this is that you can easily highlight, copy, and paste it into your electronic health record, preventing the need for dual documentation by your staff. Once you have copied and pasted the note into your electronic health record, you can close out of this window. The second document that is generated is the SBAR form, which contains all the information you typed into the system. In addition to that, abxtracker.com reviews the patient's signs and symptoms and determines if the patient's current signs and symptoms meet the criteria for an antibiotic medication and alerts the provider to that. In this case, the criteria has been met for an antibiotic medication. Please note that this criteria only applies to UTI, lower respiratory infection, skin wound infection, and the other infection SBARs. As you can see, the patient's signs and symptoms are listed here, as well as any other information you type into the system. The last portion of the SBAR form is examples of non-drug interventions that the provider can do besides order an antibiotic, in the event an antibiotic medication is not indicated. It also provides an area where the provider can order an antibiotic here, as well as calculates the creatinine clearance for the patient so the provider can order a medication appropriately for the patient's kidney function. you'll see a print and a close button at the top. This form can be printed and faxed to the provider or saved as a PDF via the print button here and securely emailed to the provider, whichever you prefer. After you print or save the PDF, you click the close button and it will bring you back to the welcome screen. On the welcome screen, you'll see the order or the SBAR form on the pending order list. Once you get a response from the provider, find the appropriate form by searching using the unique patient identifier, or utilizing the sort functions on the top of the pending list. Infection type, date entered, room number. For our purposes, we'll use date entered, which is today. Note that you can always replicate an SBAR form by clicking the appropriate spyglass or an EHR document by clicking this spyglass here. Let's say you get a response from your provider. You find the form, in this case, this is ours, and you click the hyperlink Finish SBAR. This will bring you to the results page of the SBAR. Now, click on the appropriate responses that the provider indicated. If a medication was ordered, we enter it here. Indicate by saying yes, and fill out the appropriate form, including date prescribed, medication prescribed, the dose of the medication entered in milligrams, the route of administration, frequency of administration, and the duration of therapy. The specific diagnosis for the medication, if indicated, and the type of infection where it was required. Community, hospital, or nursing home infection. Lastly, we indicate the prescriber prescribing the medication. Now we click the Submit Provider Responses and close the tracking SBAR form. Now the form is closed and it will bring you back to the welcome page. It is also important to track if the antibiotic worked or not, or what happened to the patient. To complete this, you go to the Outcomes tab on the menu. Let's go to Enter Patient Outcomes. Below is a list of SBARs that have been generated and results tabulated. Let's find our SBAR by using the sort function here. You then click on the outcome hyperlink. Then simply click on the appropriate patient outcome: successful, failed, antibiotic discontinued to adverse event, antibiotic discontinued early due to reevaluation or an antibiotic timeout, or the bacteria was not sensitive to the original antibiotic and a new medication was started. You can also type anything else that happened here. Then let's click the Submit Treatment Outcome for tracking. That fully closes out the SBAR. Then you need to go back to the Welcome page via the Welcome tab and the Welcome button. Again, the same 3 steps are utilized for each SBAR under the New Infection tab. 1. Fill out an SBAR form, whichever one is required. 2. Once the provider has responded to the SBAR form, log in and enter the provider responses under the pending list here by clicking the Finish SBAR hyperlink. 3. complete the outcomes section after the antibiotic was completed here, or if the antibiotic was discontinued early or for whatever reason. That is it. If you feel like you've made an error on any SBAR form, please alert your administrator or the person with your administrator login. This concludes the video on how to use the new infection tab. Thank you.